Welcome to the Health Matters program produced by the Ministry of Health. I am your host, Alicia Martin. As the Guyana Medex program celebrates its 48th anniversary, joining me in the program today is Chief Medex-Carleen Howard. Welcome to the program, Chief Medex Howard.
Thank you for having me, Alicia.
So I know that the Medex are celebrating 48 years in service. Tell us a little bit about this. This is an exciting time for you guys, an exciting achievement.
Yes, it is. On the 18th of October, 48 years to be exact, we had the establishment of the Medex program. Then, of course, you had what many would know as the traditional pathway, where you had existing midwives, registered nurses, would have left the working setting and go into the training program. That over the last 10 to 15 years, to be exact, because I'm a product of the alternative pathway. So in 2006, you had the launching of the new pathway for the Medex program. That would have eliminated the fact where you did not have to use existing human resources. So that would have actually prevented a gap from being created. So you had early school leavers that would have just written CXC, or even post-UG or any university would have been given the opportunity to apply for that program. From then to now, we would have had 4 batches of that program. Where we currently have 1 that is ongoing. And of course, because the duration of that program would have exceeded the amount of the traditional pathway of 42 months, it would have caused a delay in the turnover time to fill existing gaps of at primary healthcare facilities. So because of that, we would have recently started another batch of traditional pathway. So we did not rule that out, but we would have just put a pause on it. And right now we have one of the traditional pathway and we have one of the alternative pathway. And of recent, if many would have noticed, we even had an ad to start another batch of the new pathway. So with all that we have with advanced technologies, with advanced healthcare, because yes, we do know we have a lot in infrastructure, not only in the tertiary setting, which are hospitals, but also in the primary healthcare, where the Medex would focus on, which is level 1 and levels 2, the health posts and the health centers. And you may find Medex at preventative clinics, at some hospitals, like for example, we have a Medex that is attached to Georgia Public Hospital at the VIA clinic. And of course, we're in Breast Cancer Awareness Month. And of course, we know we can get cervical cancer. So that is another area. We have Medex attached to several other areas. So rest in mind that the only place you can find a Medex, it is not only at a health center or a health post. We currently have a Medex coordinating the Medex program. You have myself as a chief Medex. So you may find some of us in administrative roles, but at the end of the day, our main goal is preventative measures to maintain and to enhance health.
Indeed, thank you so much. How has technology and modernization in healthcare impact the work of Medex across the board within all of our regions?
Okay, great. Thanks for asking that question. So that actually leads me to the fact that we have at least 50% of our Medex employed in the hinterland regions 1, 7, 8, and 9. And even on the coastlands for the riverine areas like Maracaibo, you have Medex attached there. And years ago, we would have wondered, or you had many challenges where you had a patient, you're not sure what to do. But today, and even let's say for the last 2 to 3 years, we have what we call the telemedicine, which is telehealth. So the same screen that you're looking at now, we have something like that with other medical apparatus that are attached to that. So the Medex and even the other healthcare workers across these 10 administrative regions, they can actually call out for a consult from either a more senior Medex a general medical doctor or even a specialist. They're even given the opportunity to call out to Georgetown Public Hospital, and we even have a telemedicine hub where it is done in such a way that the specialties for the hospitals, they're being contacted. So a patient can be, geographically, we have Guns, Canary, that is at the bottom of our map. You can have a patient there, and the health worker is able to call out to Georgetown Public Hospital, because if you do know, it probably takes about a week to get to Guns, and if you think of logistically with the cost, by the time the patient gets to Georgetown or even to Aishalton, which would be the nearest hospital if you want to go by road, or if we go by plane, it will take probably, let's say like 4 hours, because that aircraft would have to leave Ogle to go there. So all of that would have reduced significantly the amount of lost time for the patients, and thereby it also would have added the self-esteem of healthcare workers, given the fact that they can help the patient, they can help treat the patient without seeing the patient in a condition that he or she cannot manage, sometimes not because of knowledge, but because of the existing resources that are available at that level of care.
What is the typical role of a medics in the field or even at a regional health facility?
Great. So the role of the medics focuses severely on preventative measures. We prevent illnesses from reoccurring or from occurring, to actually enable that patient, to empower that patient to have lifestyle modifications, so that at the end of the day, they will not have a severe condition. Let's take, for instance, we're in the month of October. Yes, we're celebrating breast cancer awareness. So as the role of the medics, it is critical, it is integral that they engage not only the patients that are coming to the facility, but also the community at large, through churches or other faith-based organizations, through the schools, which is very important, and it actually ties into our school health program that we have ongoing through all of the 10 administrative regions. And so when we come to realization that we will encourage patients to check yourselves, do screening measures, eat healthy, exercise daily, drink a lot of water. If we nip it in the bud, as layman would say, we prevent all of these things from happening. Our famous Dr. Greaves from Chronic Disease Unit, she would have alluded or will allude to the fact that screening, prevention is better than cure. And if we look at all of the infrastructure that we have ongoing, we can encourage our patients. Gone are the days we can tell patients, do you see this thing on the TV that is in the United States or another country that persons would say, okay, it's more developed than us. But we can now refer patients to maybe a hospital right in our district or right in our community. So gone are the days we have to procrastinate, but we are now in the we have to do. And yes, mammography you can do for patients, but also as women, we can do our self-examinations. And as a medics, as the fellow medics across the country, it is critical that we encourage patients, and we can even show the patients through health talks, through demonstration of how you are doing this. Because yes, we can tell patients, but the more we show our patients, philosophy would have taught us, we show a patient something, they will learn more, they will remember more, because we can tell them. But we do know we have shy patients that will not want to ask a particular question. So once we show them, and then they're going to be like, yes, this is what medics is talking about, right? So preventative care, preventing illnesses from getting further, that is our main role. And of course, at all times, we encourage or we intensify health education, because at the end of the day, if we're not literate with health concerns or health matters, then it makes no sense. It doesn't matter the school you went or the university, the PhD, if you're not conscious health-wise of health decisions, you will not be able to make informed choices. And we're in October, and October brings a lot of emotions for me, right? But for those of you that are listening and you have siblings or you have parents, family members, relatives that would have passed away from any cancer, any form of cancer, not just because we're in October, we focus only on breast, but it is so important for you to see screening, see checking yourself, see going to your neighbor, see taking one of your relatives to say, let us go and screen, because of course, many years ago, a lot of people would have died, but they were not sure why. Today, the modern time, we are able to diagnose. So we have a cause, and because we have a cause and you have a diagnosis, we can have preventative measures. And some of those preventative measures are one of the main one. It is screening. Screening is important. And I can never go away from the fact that I do enjoy being a medical extension officer, which is the meaning of Medex. And a lot of people, all the time, they know Medex, but it's the medical extension officer. And wherever a doctor cannot go, the Medex is there. And the Medex has so many roles because we're midwives. We can do pharmaceuticals. We can see patients to diagnose patients. The only thing so far that we have not ventured out to do is the surgical aspect, because we are not licensed to do that. And when we look at the legal aspect, we are licensed with the medical council that is guided and headed by our chief medical officer. So we're not just there in the health facilities, but legally we're guided and we are governed by the medical council.
Medics are described as the bridge between the doctors and the nurses. Tell us, how do you guys manage or balance these roles and responsibilities in your daily duties?
Okay, so the balancing of the roles, it varies based on your location. Because let's say you're at a facility where you have a pharmacy staff, you have a midwife, and you're the medics, then definitely you will be focusing more at the outpatient chronic disease setting. Whereas if you're at a facility, and I cannot say the hinterland, because the hinterland now is now populated with all category of staff. So based on the staff deficit at the facility, that is the role the medics is going to take. But at the end of the day, even if you have a doctor there, the medic still practices in the phase of seeing patients, because he or she would still need to maintain their skills. And especially the doctors are senior to us, so we can actually see our patients if we have or we need second opinion. The doctors are there. And so even if a doctor is not physically there at the center, and we are at a health center or health post where we have telemedicine, we can call out using telemedicine. The vital signs are being done with the telemedicine mechanism. They can even do ultrasounds. So based on the location of the medics, that is the role we will play. And I know every medics in Guyana would have, or kind of attest to the fact where they were the only they were the only staff that you had to do the pharmaceutical, that you had to deliver that baby, that you had to then do a post-op visit or a post-op consultation for the patient. So based on your area, or based on the geographic area the medics is located, he or she will, they will conduct that particular role within their scope based on the legal aspect that they're licensed to do.
Thank you so much, Chief Medex Howard. We're going to go into a short break and be right back. Have you heard? The Ministry of Health has launched its cervical cancer screening voucher program for women aged 21 to 65. Eligible women can pick up their vouchers at any distribution site in their regions. Each voucher, valued at $8,000, can be used at any of the health facilities listed on the back of the voucher. Cervical cancer caused by persistent HPV infection is the second leading cause of cancer-related deaths among women in Guyana. Early screening is crucial to detect and treat precancerous cells. Early detection saves lives. Ladies, don't hesitate to get screened for cervical cancer today. Your health matters. For more information about this program, call 227-4357 or visit the Ministry of Health's Facebook page. The Ministry of Health has launched its eye testing and spectacles program. This initiative caters for anyone under 18 years of age and persons 50 years and older. Persons requiring an eye test can utilize a voucher valued at $2,000 at any of the opticals listed at the back of the voucher. If a patient requires spectacles, he or she can then uplift another voucher valued at $15,000 to cover the cost of the eyewear. Vouchers are available at various hospitals and health centers in your region. To learn more about this program, call 227-4357 or visit the Ministry of Health's Facebook page. Your eye health is important, so why wait? Get your eyes tested today. Your sight, our vision. Guyana is taking a bold step towards a healthier future. Introducing the Universal Health Voucher valued at $10,000 available to every citizen. This initiative by the government of Guyana gives you the opportunity to access early screening tests for non-communicable diseases like diabetes, hypertension, and cardiovascular conditions, with NCDs accounting for approximately 68% of all deaths in Guyana. Early detection is important. This program represents a $5 billion investment in the health and well-being of our nation, benefiting 500 people across the country. Eligible individuals include children from birth and adults 18 years and above. At the back of the voucher, you'll find a comprehensive list of tests available to you. To locate facilities where you can access these services, simply scan the QR code provided. This will direct you to a list of accredited healthcare providers. Don't hesitate. Visit your nearest health center to uplift your voucher and take charge of your health today. Welcome back to the program. For those of you who have just tuned, today we're talking about the Medex program. In Guyana, we're observing 48 years of the Medex program here. And so today I have with me Chief Medex Howard. Medex Howard, for those persons out there who wish to get into this field, what is the procedure and what is needed?
Okay, Alicia, thank you for asking that question. So, to get into the Medex program, you have to have at least 5 CXC subjects, grades 1 to 3, with a science subject. Even if you have more than one science subjects, that is the entry requirement. And of course, you can apply when the ads are being shared on the Ministry of Health page. And even for us healthcare providers, you would oftentimes, well, I can speak for myself, we would usually post it on our social media platform to encourage those that are pensive on a career path to apply. And of course, after that application process, you have the selection, and once successful, you will be called.
All right. For those persons who are considering it, what would be your encouragement to them? I know we celebrate 48 years this 2025. And so what would be your encouragement to those persons?
So the traditional pathway, it's for 18 months to 2 years, given the fact that you have healthcare workers that would have already went through rigorous training, the registered nurses, midwives, or the midwives only. So because of that, the program, it's a duration of 18 months to 2 years, where they will, of course, do the pathophysiology and all of the other amenities when it comes to diseases and managing of healthcare diseases. The new pathway that I did mention earlier, because of the fact you have non-medical personnel or non-medical candidates applying, that is going to, that is the reason for the 4 years or the 42 months that they will take, because you have to do clinical nursing. Then you will go through the phase of doing midwifery, followed by the medics aspect, the medical extension officer aspect of that program. And yes, this year we are celebrating 48 years since the Medex program would have been in existence in Guyana. And of course, that came about due to the fact that we did not have, we hadn't enough doctors or general medical doctors to occupy or to work at all of the healthcare facilities that we have. So due to that, we're happy to have it because we are able to provide care, optimal care to our residents or to citizens, where the doctors now are placed at a higher patient flow, like the hospitals, or even you have doctors that are going to specialize, right? So yes, we're happy for everyone to celebrate with us, celebrate the importance of having a Medex in your community. If you do have a Medex in your community or you know a Medex, what you can do is encourage that person that he or she is doing a good job. You can even post that person if you may, right? Because we do know once we're effective workers, once we are effective medics, then our patients are happy to celebrate with us. They're happy to appreciate the fact that yes, I have a medics. I have a medics that does so much. I can only speak for myself. Every medics would have a different story or stories to talk. I remember when I just came out of classroom, I worked not far from home, but subsequently, maybe let's say a year or two after, I went to Region 9 to work. And if we compare Region 9 with Region 4, we will find a lot of differences. But given the person that I am, I went with an open mind. And of course, my patience that I would have developed a bond, develop that the level where they can trust you. They will not omit anything in terms of their health or what is bothering you or so we as medics, that is the type of relationships we would have created with patients. So given the fact that we are celebrating our 48 years, that should not be a problem for anyone to celebrate with us, because many of you that are there would have been delivered by a Medex. We have our famous Medex Barnes, who everyone from Barometer or Region 1 would know. May her soul rest in peace. We have so many Medex that would have done tremendously, that would have worked tremendously, that would have given their all. And for some reason, there is an old age affiliated or affixed to Medex. If somebody here, Medex so-and-so is coming, if they don't know the person, they always think it is a big person. So it is good, it is great for everyone to know that you do have young medics like myself, or even younger, right? Because we now, as I said, we're on the fourth batch. We had the fourth batch graduated about a month or two ago, and they are now completing their preceptorship. So we had a total of 29 graduates from that batch. So all of the regions, most of the regions would have sent or would have submitted applicants for that. So they would have received back those medics within their areas. And we would have seen the love that the communities would have shared, because, we would have sent one of our own. And coming out from that, it is important that as leaders of communities, village leaders or key informants, that we encourage our young people to find career paths, because it is better if you send candidates from the different villages. So at the end of the training, you wouldn't have somebody being optimistic on if they want to go, let's say, into hinterland region. But when you send your own and they receive the training, then of course you will receive back those persons. So it helps with the village, it helps with the individual, it helps with the community at large, and of course it will help the health sector in totality, because if we have to send somebody from another region to work in somewhere that they do not belong, Then we have to factor in accommodation and everything else. And of course, if they're going with their families, you have to think about if they have children, the children will now have to change schools and all of these different things. And as parents, we do know the motivational task it takes to actually introduce a change to our children or to our child.
Yes.
And much less that it is going to be, let's say, for a year or two, or even an indefinite period. So my appeal here is for every region, especially our hinterland regions, all of our healthcare programs that we have, particularly the Medex, because I can only promote the Medex more right now, right? You identify those candidates. You have the necessary personnel approved within the region, approve that application and have them apply, because at the end of the day they're going to start as that particular health worker, but they're not necessarily they wouldn't have to remain as that person. I'm saying that to say that they can upgrade themselves, because
as
currently
time progress,
we have 2 medics that are doing medicine. Also, we have a Medex that is now an optometrist. You have medics that would have completed, well, not only their degrees, but their masters. And of course, given the fact with our government, we have many scholarships that you can do online. So you can work, you can be the mother, you can be the father, and at the same time, you can elevate yourself. And with our telemedicine, they can also utilize that platform to have internet access to edify themselves. So you're not going to start at one particular occupation or one particular healthcare job and remain there, but you're given the opportunity to elevate. We have our community health workers that are currently doing either the nursing assistant program or the midwifery program, or even the registered nursing program on the hybrid platform, all thanks to advancement of technology. So we're not only using technology to see our patients, but we are using it also in education aspect, and we do continue educations like that as well for the healthcare workers that would have telemedicine sites.
Thank you so much, Medex Howard, for sharing with us today. And I want to say congratulations to all of our medics here in Guyana and across the regions of Guyana. Thank you for staying tuned on the Health Matters program. I'm Host-Alicia Martin saying goodbye for now.